Hi guys, I'm Trudi. Welcome back to my YouTube channel. Today I want to talk about the difference between an OTA and a PTA. Now, while both require an associate's degree, both focus on different aspects of rehab. In this video, I will discuss the differences, the education level. Now let's get into the video. Also guys, please remember to subscribe to my channel and click the bell so you get notified every time I post a new video. I post a new video every Sunday. Now, OTA or occupational therapy assistant focus more on activities that are meaningful to the patient. It might be dressing, hygiene, grooming. Now, the patient might want to learn how to play golf again. It really doesn't matter. Like, whatever is meaningful to the patient, that's what occupational therapy assistants focus on. Whereas a PT assistant or PTA, they focus more on ambulation and gait training. Now, in terms of education, an occupational therapy assistant require an associate's degree, whereas a PTA or physical therapist assistant also require an associate's degree. Now, in terms of supervision, both an occupational therapy assistant or OTA and a physical therapist assistant, PTA, both require supervision. But the supervision is a little bit different. Both OTA and PTA require supervision from occupational therapist and physical therapist. But the difference is a PTA require on-site supervision, whereas an OTA does not require on-site supervision. Of course, there are different levels of supervision for the OTA. It depends. If it's a new grad, supervision has to be more direct. Whereas it's an OTA who has service competency, the supervision can be more distant. On the other hand, for PTA, it doesn't matter if it's a new grad. They have to have on-site supervision. Meaning, if the PTA comes in the morning, they cannot start work unless their supervisor, which is the physical therapist, is in the building. I feel like OTAs have it a little bit easier. And why I say that is that as an occupational therapy assistant, you can come in the morning and clock in for work. You don't really need your supervisor to be in the building for you to clock in and start work. The PTA, on the other hand, they need your supervisor to be in the building in order for them to clock in and begin work. I would say OTA has a little advantage over PTA when it comes to supervision, because if your supervisor is running late, that kind of is going to affect your day, whereas for the OTA, it doesn't really affect it. And in terms of boards, now both OTA and PTA are required to take and pass the boards after they graduate from their accredited school. The OTA, as well, there's no limit on the amount of time that an OTA can take the boards, whereas the PTA, there's a limit of 6 times. Now you might be saying, does somebody need 6 times to take and pass the boards? Well, for some, yes. So for the OTA, there are different time frame when you can retake the boards. As an OTA, for instance, if you fail it 1 or 2 times, you can retake it in 30 days. But if you fail it more than 3 times, there are different time frames when you can reapply to take the boards. Also, I have a video on this channel that goes more in depth about how OTA can reapply for the boards. The PTA, on the other hand, is if they fail it the first time, you have 5 more attempts. So you can't, I'm not saying that, well, it's a disadvantage, because after failing it the first time, you're gonna know in the back of your head that I have 5 more tries to take the boards. So that's something with OTA versus PTA. There's a limit on the amount of time you can retake the boards for PTA, whereas OTA, it's unlimited as of now. However, there are different time frames when you can retake the board for OTA, depending on how much attempts you've already taken. And in terms of salary, a OTA makes a little bit more than a PTA. And this is I took this from the Bureau of Labor and Statistics, BLS.gov. And according to the BLS, for OTA, it's $61,000, whereas for PTA, it's $58,000. That's the average annual salary. Now, a difference of $3,000 is not really that much of a difference. But, and I mean, this is just my opinion. I think it's because of, you know, like some of the things that OTAs have a little more flexibility for. Because being that PTAs require on-site supervision, things like early intervention, you don't really find PTAs doing early intervention, whereas you find a lot of quotas doing early intervention. If you have to have your supervisor with you all the time, then what's the point of getting a PTA? You might as well just get the PT. Whereas for the OTA or quota, you don't need that on-site supervision. So OTAs can do early intervention, whereas PTAs have difficulty. You know what? Maybe some states might have different stipulations, but I know in New York, you don't really find PTAs doing early intervention. So I think that may be one of the reasons why the salary is a little bit more for OTA versus for PTA. And it's kind of interesting because for PT salary, it's higher for PTs than for OTs. But for OTAs, it's higher than it is for PTAs. So you might be wondering, okay, I want to do OTA or PTA, which is better? And you know what I'm gonna say? None is really better. It all depends on you. And another thing, well, maybe I shouldn't say this, but you already know, some of you might already know that I attended OTA college first. And you will find in most OTA programs more women than men. Whereas what I saw at my college, the PTA program, there was like an even split between women and men. But in OTA programs, you usually find more women than men. So I'm not saying that if you're a woman you should go for OT versus if you're a man you should go for PT, but I'm just sharing my experience. So in terms of which is better, it all depends on what you want to do. As I said earlier, OTAs focus more on, you know, the activities that are meaningful to the patient. So in all honesty, it's kind of hard to define what OTAs do, because what is meaningful to one patient might not necessarily be meaningful to the other. So for one patient, what's meaningful might mean, you know, putting on your makeup, or the other person might be playing golf. But then for the other person, it might just be, you know, baking a cake, being able to clean their house again. So that's really more what OTAs focus on, whereas PT, they're more focused on ambulation, gait training. So if you're more into, you know, ambulation, gait training, strengthening, you might want to go for PTA or physical therapist assistant. Whereas if you're more concerned about, you know, like the well-being of the patient, you know, what's meaningful to them, how to get them back to that point where, let's say, I don't know, they used to take care of, like a grandma, she used to take care of her grandchild, and she want to get back to that stage where she can do it, you might want to choose OTA. So I'm not saying none is better than the other. It's just, you know, do your research and see which is a better fit for you. Okay guys, that's it for this video. Thanks so much for watching. Please remember to like, comment, and subscribe, and share this video with someone who you think it might help. Also, please click the notification button so you'll get notified every time I post a new video. I post a new video every Sunday. Also guys, please drop in the comments if you're thinking of applying to OTA school or PTA school. Hope this video was helpful. Thanks so much for watching, and I'll see you in the next one.